Fibro TV, making positive connections in the chronic illness community. You're listening to the Daily Dose of Health and Wellness with Jen Reynolds.
Fibro TV, making positive connections in the chronic illness community.
My body hurts.
The information contained on fibrotv.com is meant for information and entertainment purposes only. Any information via audio, video, or print material should in no way replace any advice or direction given to you from your personal physician or medical caregiver. Please consult your physician for specific treatment options.
My headache hurts. I've tried aspirin, Advil, extra strength, Tylenol, and such. Nothing seems.
Well, hello everyone. My name is Jen Reynolds, creator and founder of fibrotv.com. We are on the Daily Dose of Health and Wellness, episode number 15. And today we're going to be talking about addiction versus dependency, the great pain medicine debate for those with chronic illness and chronic pain. So sit back, relax, and enjoy the podcast. Pain medication. Don't want to live with it, but some of us just can't live without it. And it's quite the debate, and it's a very hot, emotional debate among people that suffer chronic pain and chronic illness. I wanted to really touch base on this subject because there's a lot of misinformation out there, and there's also a lot of myths out there. And this doesn't just happen to those that do not suffer from chronic illness, but there are also myths and misinformation for those that do suffer from these. It's on both sides. And I wanted to address it because I've talked to pain specialists, regular MDs, and even an addiction specialist a couple years ago about these myths and just pure, utter not understanding the whole addiction thing among everybody, not just people that have chronic illness, but the general public, even some doctors and family members of those that do suffer from the challenges of chronic pain and chronic illness. First of all, let's talk about the difference between addiction and dependency. Dependency is actually when you've been taking a medication for a very long time and your body gets used to it and you have to take it every day to not have withdrawals. This does not just happen with pain medication. This happens with antidepressant medication. Like SSRIs, you can have serotonin withdrawal syndrome, and there's several medications that if you quit taking right away, you can have very disturbing symptoms from withdrawal and also some very bad physical symptoms if you do not wean off them properly. Now, this is what's considered dependency. Dependency is not psychological, it's purely physical. And that's the main key, is it's a physical thing that you have to take care of medically to come off of a medication. There's no psychological issues involved coming off of it. You want to get off of it, you just can't without going off it slowly. That is what's considered dependency. Addiction, on the other hand, is dependency, and it's a psychological addiction. It's very psychological. I've talked to many pain specialist doctors and those that specialize in addiction medicine, and they have told me one of the big red flags for addiction is when you wake up, the first thing you think about is that thing that you're addicted to. So if you're taking a pain medication, it's the first thing you think of when you wake up in the morning, and it's the last thing you think of when you go to bed at night. It basically consumes you to make sure that you have an abundant source of this substance with you at all times. It's almost obsessive. Also, another thing that addicts will do, they will do things that they wouldn't normally do before they became addicted to whatever they are addicted to. One other sign that, a few doctors have spoke to me about is people trying to refill their meds early and lying in order to get them refilled early. So people will go to the pharmacy and they'll say, I'm going on vacation, or somebody stole my medication, or, these things do happen, but when you're doing it, when these things have not occurred and you're lying, that is a huge sign of addiction. Also, there's huge personality changes when you become addicted to a substance. Your relationships will start to fail. Not just relationships with, a lover, but your family and friends. You'll start isolating yourself, and you just aren't the same person that you used to be before you became addicted to a substance. Another big red flag is taking the substance to get high or get the euphoric effect that you get from taking narcotic pain medications. If you're taking medication and not for symptom relief, and you're taking it for that feeling that you get when you take it, that is a really big sign of addiction, and this is like a mental addiction. Dependency is so different because you're only taking it for symptom management. A good example of dependency is the medication Paxil or any SSRI. These medications are they cause dependency in a lot of people after taking them for more than a month or so. And you can dump Paxil all over the street in a neighborhood that there's tons of junkies or drug addicts. They're not going to care because Paxil does not make you high. It just doesn't make you high. It doesn't do anything like that to you. But if you throw, Vicodin and OxyContin on the street, all these addicts are going to go after it because they're looking for that high that they get off of it. So the big difference between addiction and dependency is that you're not going for the high, you're going for the symptom management, and that is it. So these are just some of the things that you can look for if you're taking a pain medication and you want to watch out for addiction. Also, I wanted to talk a little bit about some of the misunderstandings and some of the myths that surround pain medication for those that are in the chronic illness community and those that are outside the chronic illness community, because there are there's misinformation on both sides, and I wanted to touch base on that. One of the things that I really wanted to talk about on those that do have chronic pain and chronic illness that is a huge myth is that if you have chronic pain, you cannot become addicted to a medication. That is completely, utterly false, and it is untrue. Anybody can become an addict. It doesn't matter if you have chronic pain or not. And becoming an addict to pain medication should not be something that you should be ashamed of. It should be something that is dealt with. It can be dealt with appropriately. You might even be able to go back on the pain medication eventually with maybe closer supervision with your doctor. But it does need to be something that's addressed, because it's just going to continually make your life negative and have negative consequences in your life, and you're not going to be happy and fulfilled as a person. It's such a hard thing to deal with this subject when there are people that have to take this medication, and some of them do get addicted. And the physical part, the dependency is fine, but when you start getting that psychological part, that's when you really need to reach out for help and just be aware that, this is going on with you, and things can change if you keep an open mind and your doctor keeps an open mind. Say, I'm just getting a little bit worried, that I'm taking too much medication, I'm thinking about it too much. It's something that you both can work on together. Another huge myth that's not on the side of the chronic illness or chronic pain sufferer, but those that are around us or outside of us, is that if you're taking a pain medication that's a narcotic med, that you're an addict. And that's completely untrue. A lot of people take their medication as prescribed. They take less than prescribed and only take it when it's needed, and that they are not addicted to anything. There is not a psychological component there that causes negative consequences in their life. the medication is just a tool that helps them deal with their chronic pain or chronic illness. There's many people that have chronic pain that have been on medications for years and have been on them responsibly and have taken them appropriately. These people are not addicted to their medication. And it's really a shame because many people, as soon as they hear you're taking a narcotic pain medication, the first thing that comes into their mind is, oh, they're an addict. And it's really a shame because there are some people that do need these medications. I think they're prescribed a little too much and not as many people need them. And I think that they're getting into the wrong hands. I think that addicts have a way of getting these medications out of doctors, ERs, and they give people that legitimately do have a chronic illness or chronic pain a really bad name. And they give these medications a bad name. And these medications are very necessary for some people. They would not have any quality of life if they didn't take these medications. They would continually suffer. And there's no reason for a person to suffer if we have these medications available to us. Unfortunately, there's a huge market for for addicts and people that abuse these medications, and they have given them a bad name. I personally strongly believe that any medication should be the last thing you try. You should always try things that will help you before going to medication. Maybe check to make sure you don't have any food allergies or intolerances. Check for the basic things first. Try meditation, try water aerobics. These things do help control pain. And once you've exhausted all of those things, if you're still suffering, you do probably need something to help you to get through your day. And there's no shame in that. And I really want to make it very clear that I made this podcast because it's something that I have seen in my life with people around me being addicted to these medications, and they had legitimate reasons for needing these medications and they became addicts. So I don't want people to think that because you have a chronic pain condition that you cannot become an addict, because it's completely false and it'll give you a false sense of security. So I wanted people to know the signs, and so that you can, monitor yourself and be personally responsible for yourself when it comes to pain medication. Because like it or not, once you are on a pain medication and you're a chronic illness or chronic pain sufferer, you are the example that you're giving to all of the doctors. And if they see you starting to abuse the medication, they're going to start to think that other people that have chronic pain and chronic illness are going to do the same thing. And then you're limiting the medication for other people that do need it as well. So it's a huge responsibility to be on pain medication, and it's a huge responsibility to use it properly.
My body hurts.
Well, that concludes this week's Daily Dose of Health and Wellness. I want to thank everybody for listening in and my loyal followers at fibrotv.com. I appreciate every single one of you, and I'm grateful to every single one of you for sticking around and having some fun with us over at fibrotv.com. If you want to find us on the internet, we are on facebook.com/fibrotv. We are on Twitter at twitter.com/fibrotv. We are on YouTube at youtube.com/fibrotv. And of course, we are on Google+. You just have to type in Google+ Fibro TV and it'll pop right up, and do the same for iTunes. And we are on the World Wide Web. Our main website is www.fibrotv.com. Thanks for listening in, everyone. Have an amazing weekend. Until next time.
Thank you for listening to The Daily Dose of Health and Wellness. The Daily Dose of Health and Wellness is written, produced, and edited by Jen Reynolds and released every Thursday, right here at fibrotv.com.
My mommy is sick, but she's the best mommy in the entire world, and I just want her to get better.
Fibro TV, making positive connections in the chronic illness community. You can find us over at www.fibrotv.com.